Hello, and welcome to the webinar Beyond Cervical Cancer, What You Need to Know About HPV. I'm Aisha McClellan, the Cervical Cancer Program Coordinator at SHARE. Before the presentation begins, I'd like to tell you a little bit about SHARE. SHARE is a national nonprofit that supports, educates, and empowers anyone who's been diagnosed with women's cancers and provides outreach to the general public about signs and symptoms, because no one should have to face breast, ovarian, uterine, cervical, or metastatic breast cancer alone. For more information about upcoming webinars, support groups, and helplines, please visit our website at sharecancersupport.org. All participants will be muted during the presentation. When Dr. Sigel finishes presenting, we will begin the Q&A discussion. You're welcome to give comments in the chat section during the presentation, but please submit your questions through the Q&A section at the bottom of your screen. When asking questions, remember that Dr. Sigel is unable to give specific medical advice, so please keep your questions general in nature. I also wanted to mention that closed captioning is available. You can enable this feature by clicking the live transcript button on the bottom of the screen and selecting the subtitle option. This webinar is being recorded and will be available on the SHARE website soon. Now I'd like to introduce today's speaker. Dr. Keith Sigel is an associate professor in the Division of General Internal Medicine at the Icahn School of Medicine at Mount Sinai. Dr. Sigel is a clinical investigator and an epidemiologist with a primary research interest in the clinical factors related to the abnormal biology of cancers in the setting of chronic infections, particularly HIV and human papillomavirus, HPV. He is currently the principal investigator of an NIH-funded trial studying novel approaches to the cancer screening in the HIV unaffected women with HPV infection. Thank you.
Okay. Thanks for that introduction, Aisha. I'm going to share my screen. So I am going to talk to you guys today about HPV and HPV-related cancers. As Aisha mentioned, I am a physician at the Icahn School of Medicine at Mount Sinai here in New York City. So my reasons for giving this talk. Well, I am an infection specialist, an infectious disease specialist, but I have spent much of my career working on cancer and the intersection of infections and cancer. One of the main reasons that I got into this area is that I am a physician for people living with HIV. And although human papillomavirus, or HPV, is a major issue for people living with HIV, it's also an important infection to understand for just about everybody. And one thing that we're doing is we're working to improve the detection of what I call second HPV tumors, meaning when a person has had an initial tumor from HPV, they are actually at increased risk of a second tumor, which I'm going to talk about. And so I have a particular focus on learning how we can better help women who have had cervical cancer and precancer in preventing those second tumors. So what we're going to talk about in this webinar, we're going to talk a little bit about the human papillomavirus, HPV. We're going to talk about why it causes problems, what happens with HPV infection to the body, the processes and stages of development of cancer from HPV, the different types of cancer that are related to HPV, and what is happening in the United States in terms of rates of those different cancers. I'm going to talk a little bit about the risk of having a second tumor or cancer related to HPV if you've already had one, and what you can do to help lower your risks of having a second HPV precancer or cancer. So what is HPV? What is the human papillomavirus? Well, HPV is a virus, just like the flu, the influenza virus, or chickenpox. Chickenpox is a virus. And these are different than bacteria, which are things like staph and strep, which cause a different kind of infection. So the human papillomavirus, or HPV, is spread through it is considered a sexually transmitted infection. It's spread through vaginal, anal, and oral contact or sex. There are two kinds of HPV that we commonly refer to, and I'll go into this into a little bit more detail as we go along. But there's what we call low-risk HPV, meaning low risk for cancer, and high-risk HPV, which means HPV types that are much higher risk of causing a cancer. HPV causes genital warts, but not all HPV types cause genital warts, and not all, we're going to talk a little bit more about the different kind of warts a little bit later. One important thing to know about HPV is nearly everybody gets it at some point. The vast majority of people in the United States will be infected with HPV at some point in their life, more than 80% of people. And of those people that end up getting infected with HPV, which is nearly everybody, about half will have an infection with a high-risk type. However, that sounds like a lot of HPV, but remember, the vast majority of HPV infections do not cause cancer. Most HPV infections are actually controlled by our own immune system. But what can happen sometimes is these HPV infections can persist. The HPV virus can continue to grow, which we call replication. And those infections that persist can go on to cause cancer. So these are two graphs that show HPV in the United States, the percentage of people that have HPV infections by age on the left here, and by race, ethnicity on the right. And what we see is that, this data is from the last 20 years, but we see that the highest proportion of people that we can detect HPV infections in are people ages 20 through 24. And that's not a surprise, because that's when a lot of people typically, begin having sex, or maybe have the most sex. So that group, we have the highest, proportion of people that have detectable HPV infections. And remember what I said, oftentimes your immune system is able to control the HPV infection. And so it's essentially gone at that point. So that's why we see people getting older and less proportions of people with HPV infections that we can measure. So overall, in the entire population at any given time, we only detect about 7% of people with HPV. So that means if we go out and measure people, we're only going to find it in about 7% of people, but almost everybody had it at some point. Okay, it's just that their body gets control of it, and you're not able to find it with a test anymore. And we do see that actually HPV tends to be more prominent in men, but reasonably similar among both men and women in the United States. So why does HPV cause problems? Well, HPV, as I mentioned, is a virus, and what it does is it actually integrates into your DNA. So it sort of breaks into your genetic material inside certain kinds of cells in the body, and it does that to support itself. In order for HPV to live and to continue to grow or replicate, it has to integrate into your genetic material. And it integrates in very specific places. It picks out places that lead to inflammation, and also places that send signals to tell your immune system not to fight it. And so it does these changes to try to promote its own life. And these disturbances to your DNA eventually cause changes which can lead to cancer. So this is how the whole process works. Before we're infected with HPV, we have normal cells, normal tissue in our cervix or our throat. I'll say you'll see oropharynx in my talk here, but what I mean with when I say oropharynx is the throat, because that's another place that we can find HPV, and in the anus. So that tissue gets infected with HPV from contact with HPV infected tissue in another person. We have an infection, and sometimes that can clear on its own. Remember what I said, the immune system is able to fight it off and clear the infection, okay? So some people end up with HPV infected tissue, but sometimes their body doesn't clear it. And so that HPV infected tissue then progresses to something that we call a precancer. It's tissue that has some of the changes necessary for tissue to turn into a cancer. Now, these precancers, they don't always stay either. So HPV infected tissue can progress to a precancer, but this precancer can also be helped by the immune system, and we can see regression of those precancers. So they can go back to normal tissue as well. As I've said several times here, the vast majority of people will clear their high-risk HPV, more than 50%, okay? And if you clear it, then it's not going to go through any of these progressions from HPV infected tissue to precancer, from precancer to cancer. So why do some people not clear their high-risk HPV infections? Well, one main reason of this is because of suppressed immune systems, and this can be from a lot of different causes. So people on medications that suppress their immune system, like after they've gotten an organ transplant, people living with HIV sometimes have some suppression of their immune system. This makes it a lot more difficult to clear HPV infection and increases the risk of cancer. Another reason is smoking. We don't entirely know why this happens, but smoking makes it more difficult to clear high-risk HPV infections. And that's one of the reasons why smoking is associated with higher risks of HPV-associated cancers. There's also things that run in people's families, which we would call a genetic predisposition, okay? Inheriting a trait from someone in your family that for some reason or another, your immune system is not able to clear HPV well. And so there are genetic predispositions that can be inherited that make it more difficult to clear the high-risk HPV. And when we don't clear the high-risk HPV, then we have an increased risk of going through these stages and developing precancers. So these are the different, when we talk about HPV types, we refer to them as by numbers. So we see a whole bunch of numbers here. There's, I think, close to 100 different types. So when we refer to HPV type 6, 11, 42, 43, 44, these are some examples of low-risk HPV types, and there's many more of them. What's more important is this smaller group of HPV types that are considered high-risk HPV types. And perhaps the most important one is this one called HPV-16. This is the largest cause of HPV-associated cancer. So these low-risk types can be associated with warts, but are almost never associated with cancer. And these types have all been found in cervical cancers before. These types can also be found in warts, but you don't always get warts before you get cancer. And that's an important thing to know that I'll talk about in a little more detail. Okay, so yes, now we're on to warts. Let's talk about warts a little bit. So we may have warts, on our hand, we may have warts in other places. Are your body warts from HPV? Yes, most warts on the body are caused by some form of HPV. However, warts that are not in the genital area are almost never high-risk HPV types, okay? So the high-risk HPV types are most frequently, associated with genital warts and not warts on other places like hands, legs, etc. So are all genital warts high risk? Are they all from high risk HPV, or are they all at a high risk of turning into a cancer? And the answer is no. In fact, probably most genital warts are not from high risk HPV. Many are not high risk. So just because you have warts does not mean that a wart is going to turn into cancer. But can genital warts be high risk HPV? Yes, they can. So some genital warts are from high risk HPV and are associated with an increased risk of cancer. But probably, I think the most important point here is this question: if I do not have warts, can I have infection, an important infection with high risk HPV? And the answer to that is yes. Okay, you can be infected with high risk HPV and there can be no warts. Okay, so just because you don't have warts does not mean that you do not have high risk HPV. So let's talk a little bit about the development of an HPV cancer. Why do I spend any time on this at all? Well, the reason I spend some time on it is a big emphasis in medicine and in healthcare, in preventative healthcare, is understanding the stages of the development of HPV cancers, because that's what we do to screen for these cancers, and that's what we do to prevent these cancers. So we're seeing here the pre-cancers, the different stages that tissue goes through as it turns into a cervical cancer. So we see the cervix here, and what we're looking at here is we're looking at body cells. So these are basically skin cells. We also call them epithelial cells, or squamous cells, we call them sometimes. And this right here are normal cells of the cervical skin, basically, the cervical epithelium, we would call it in medical terms. What happens with HPV infection is those cells get infected with HPV and they change a little bit. And we see that they look a little bit different here. They start to get a little bit unhappy and abnormal. And if that infection persists for a long enough time and there's enough inflammation, that can turn from a little bit of change, which we call an LSIL, or a low-grade lesion. It can turn into a high-grade lesion, or what we call an HSIL. The L stands for low, the H stands for high. And we take these high-grade lesions very seriously because these are the tissue right before it's going to turn into a cancer. Now, does that mean that it's going to immediately turn into a cancer for everybody? No, it actually, over 10 years, only a handful of these will turn into cancer, but we don't want that any of them to turn into cancer. We don't want to get to the stage here where we have something sitting around that can turn into cancer. Okay, so when we see these HSILs, and this is what we're looking for when we do pap smears, when we see these, we treat them, we take these out. We do some kind of, often a small surgical procedure, or some kind of what we call an ablation procedure, where we try to remove this tissue that's turned into this HSIL, or a high-grade lesion. It's also called high-grade dysplasia. So these are the different states that we go through, and what the whole purpose of screening for HPV cancers is to try to identify these high-grade lesions so that we can then treat them and prevent them from turning into a cancer. Okay, and the reason this is important is because if you've had an HPV-associated cancer, your body has gone through these stages, and there's always a chance that it could happen again if there's still HPV infection somewhere. So how do we prevent HPV cancer with screening? And the screening that people are most familiar with is screening for cervical cancer. Well, what we do is, at some interval, and nowadays it's somewhere between 3 and 5 years, we do a cervical pap smear, and or we may do high-risk HPV testing. Okay, so we're looking for evidence of these changes here, that there might be a cancer that might need to be treated. So we do a cervical pap smear, which is basically collecting cells from the cervix, looking at them under a microscope and looking to see if any of them look like that high-grade lesion, that HSIL. So if we do a pap smear or a high-risk HPV test and we find a significant abnormality, then we do something called colposcopy, which is where we look in. Oftentimes, we look in with a speculum, oftentimes with some form of camera, and we look for areas that are abnormal in the cervix by putting some dye in the cervix. And if we see areas that look abnormal with the dye, then doctors will do a biopsy to look and see if there's any evidence of that high-grade lesion, that HSIL, or that advanced precancer. If we find that, then we treat that precancer by removing it or ablating it, getting rid of it. And that has been proven to prevent the development of cervical cancer. Well, so nearly, like we've talked about, nearly everybody gets HPV at some point. Why do some people get cancer and why do some people not get cancer? Well, the most important thing, which I've mentioned several times already, is this issue of HPV clearance. Okay, some people, their body is able to keep the HPV under control, and we don't find it with tests anymore. If you don't find it with tests, then it's not doing anything bad. There's not enough of it there to do anything bad. So people that clear HPV are not going to get HPV associated cancers. Okay. Another reason is, as I mentioned before, you can develop a precancer, but your body can actually clear the precancer. So some people will get precancers and their body will take care of the precancer. Then some people go for screening. We find precancers, or those high-grade precancers, they get treated, removed or ablated, and they're not able to turn into a cancer. So screening prevents some of those cancers. And then another way that we prevent cancer is through HPV vaccination. That prevents it prevents being able to get infected with high-risk HPV types, and may actually even help to prevent some of the progression of some of these precancers after treatment, which I'll talk about in a second. So HPV cancers in the US. HPV-associated cancers are going up in the United States. They've nearly doubled over the last 20 years. But there is some good news, which I'll show you guys in some of the next slides. As you're aware, the main HPV-associated cancer in the US in women is cervical cancer. And there's about 11,000 cases of cervical cancer per year in the United States. Other common associated or HPV-associated cancers include vulvar cancer, so cancer of the skin, around the vagina, which there's about 4,000 cases per year in the United States. Then the cancer that I spend the most time with is actually anal cancer, which I want to talk about in a little bit more detail. There's about 4,500 cases per year. Oropharyngeal, or what I call tonsil or throat cancer, there's about 3,400 cases in women per year. And then cancers of the vagina. So these are the main, there are a few others, more rare types, but these are the main types of HPV cancers in the United States. And HPV causes almost all cervical cancers, and it causes almost all anal cancers. Okay, so it's really, really uncommon to get cervical cancer or anal cancer if you've not had HPV infection. It's a little bit less true with vulvar cancer. It only causes about 70% of vulvar cancers, and it actually only causes about half of throat cancers. So half of throat cancers are caused by non-HPV reasons, things like smoking and drinking and just age and sometimes family history. So one of the pieces of good news is that cervical cancer is going down in the United States. We see in this graph here, we're looking at years 1999 to 2015, and the solid blue line is the rates of cervical cancer each year. And we've got in the dotted blue line, the rates of throat cancer each year. And so we see this reasonably steady decline in cervical cancer over that time period. And we see some increases in throat cancer in men. Well, what's the reason for that? Part of it is screening and prevention. Another reason for that is HPV vaccination. Unfortunately, other HPV cancer types are going up. So in this figure, we're seeing the same range of years, 1999 to 2015, and we're seeing the rate of cancer each year for several different HPV types. So the one that I want to draw your attention to here is the solid line, which is anal cancer. So anal cancer, we're seeing a steady increase. In fact, it's one of the fastest growing cancers among women in the United States. We also see increases in vulvar cancer over time, and reasonably steady increases in oropharyngeal cancer in women. So we're making progress with cervical cancer, but the story is not as good for anal cancer, vulvar cancer, and throat cancer. So we've got a little bit of work to do. So you guys are probably aware, many people are successfully treated for cervical cancer, and we've got a growing cervical cancer survivor community here in the United States. So we have hundreds of thousands of cervical cancer survivors in the United States. It's estimated there's more than 250,000 cervical cancer survivors living in the United States right now, and many, many, many more that have had high-grade precancers. So those the skin lesions that are right before cancer, the HSILs, I called them in the previous slide, more than 20 million women. So if you've had either of these conditions, it's important to know, and you're probably aware that you are not alone. There are many, many people that have been through this experience, and we're trying to make things better for both of these conditions. So one of the big purposes of this talk, and it's not to create fear, but it's to inform, is that having had a first HPV cancer puts you at a higher risk of a second HPV cancer. Okay, so in other words, if you've had cervical cancer, your risk of getting a second cervical cancer or a anal cancer or a throat cancer or a vulvar cancer is higher than a woman that's never had cervical cancer. Okay, and so what's the reason for this? Part of the reason is, I talked a little bit earlier about why do some people not clear their HPV? Well, some people just have a predisposition to not clearing HPV. They have an increased susceptibility to HPV, or they have some condition that suppresses their immune system, and because of that, they are at risk of second HPV-associated cancers. So what we're seeing in this figure, these are summaries of a bunch of different studies showing what the risk ratio is. This is a sort of a medical risk term that we like to use for second HPV cancers if you had a first HPV cancer. And what we see is for things like anal cancer, your risk is up to 30 times higher than someone that's never had a first HPV cancer, if you've had an HPV cancer. So, again, the purpose of this is to inform. It's very important that people that have had an HPV cancer continue to undergo screening for second HPV cancers if there is screening available. And we're going to talk about a few things that people can do to try to address their risk. So this is something that I have spent some time looking at, which is second HPV cancers after a person has cervical cancer. So we studied this using national US data. And what were the cancers, if someone had a cervical cancer, what were the cancers that they were at the highest risk of afterwards in terms of HPV-associated cancer? And by far the highest was vaginal cancer. Well, what's the reason for that? Well, the vagina is the closest area to the cervix. If you had HPV infection in the cervix, that HPV infection might have been treated, but there may have still been some HPV infection in the vagina. And so we see a higher risk of vaginal cancer, but we also see increased risk of vulvar cancer, a little bit of an increased risk of throat cancer, and nearly a double risk of anal cancer. And 1 in 50 women who had a first cervical cancer, 1 in 50 women went on to be diagnosed with an HPV cancer in a different area. The other thing, this was all talking about what happens after your first cancer. Well, what if you've just had a precancer or one of those high-grade precancers that I've talked about that are so important to identify and treat? Well, after those high-grade precancers, we still see an increased risk of HPV-associated cancers. What we're seeing here is, in blue, is what the risk is of a second either tumor or cancer after you've had a high-grade cervical precancer. And what we see these big blue lines. The yellow are people that did not have the precancer. The blue are people that did. And we see that any HPV-related cancer, particularly anal cancer, vulvar cancer, vaginal cancer, the risk is increased if you've had a high-grade precancer in the cervix, okay? And the reason for this is just that the HPV a lot of times is still there. It's just in other places, sometimes places that we have not looked for it, sometimes places that we have not tried to treat it. So if you've had a high-grade cervical precancer, the risk of precancers and cancers from HPV in other places is increased. So I've mentioned a couple times, the cancer that I spend the most time with is anal cancer. And I think it's particularly important because anal cancer is going up in women. This is a research study that we did a few years ago, looking at anal cancer in women. It's going up 2.7% each year. And more and more women are dying of anal cancer each year. And it's particularly prominent among older women. And perhaps the most striking thing that we found is that in women above the age of 60, there will be more anal cancers diagnosed than cervical cancers over the next 10 years. So anal cancer is becoming an important HPV-associated cancer. And we think this is a big problem because we're not doing enough about it. We're not looking for it. We're not trying to screen or prevent it. And remember that graph that I showed you that cervical cancer has been going down over the last 15 years. We think some of that is from prevention, and we need to start doing some of these things for anal cancer. Unfortunately, anal cancer sometimes is something that people are uncomfortable talking about, but we're doing what we can to change that. And so, like I mentioned, this figure here, this graph, is showing the direction of anal cancer. We see here years and rates of the different cancers. And if we just look here at the one in the middle and the one on the right, these are different groups of women. Cervical cancer is going down, anal cancer is going up, okay? So we think that this is something that we need to start addressing. Okay, so I've spent some time talking about this risk of second HPV cancers. What can we do to prevent these second cancers? Well, one of the most important things that we can do is the HPV vaccine, okay? HPV vaccine it protects against 9 types of HPV. That's why we call it the 9-valent vaccine, okay? Protects against 9 high-risk types, and these are types 6, 11, 16, 18, 31, 33, 45, 52. And it's got the big one in here, HPV-16. HPV-16 is the worst. It's responsible for the most cancers. We give people 2 doses of the HPV vaccine. First, we give them their first one, and then we give them the second one 6 to 12 months later. And this vaccine is very effective, and it causes a very strong immune response against the HPV types in the vaccine. So I strongly recommend HPV vaccine. And if you've had cancer, I still recommend the HPV vaccine. And I'm going to go a little bit into that, why that is in a second. I say it here on this slide. So we've recently had a change in the ages that are allowable or recommended by guidelines and are going to be supported by most insurances. Women up to age 45 can be vaccinated. Okay, so that is a change. It used to be 28. Some people ask, well, I already had high-risk HPV. Should I still get the vaccine? Well, yes, because you may have had one high-risk HPV type, but not another. You may have had type 31, but you never had 16, which is, arguably the worst one. So you want to get that vaccine because there's a chance you might be exposed to HPV 16 at some point. We're learning more and more benefits of the HPV vaccine over time. We don't think it's solely limited to just preventing HPV infection. And there is evidence, this is a graph from a study that was looking at the benefits of vaccination on keeping away cervical precancers. So you had a cervical precancer, you got it treated, what were the chances it's going to come back? And there is evidence to support that giving people the vaccine prevents precancers from coming back after they've been treated. So we've got more than one reason to get vaccinated, okay? So the question is, should women who have had cervical cancer or precancer get vaccinated? Yes. I know I've had HPV, should I get vaccinated? Yes, you should still get it because there's multiple types of HPV. One other question that comes up a lot. If I get vaccinated, knowing that I have an HPV infection, might it help me clear my HPV infection? Unfortunately, we have no evidence to suggest that it helps people clear their HPV infection. So we don't have that as a reason to do it. But I think that there's other, no one out there has been infected with all the well, it's very rare to have been infected with all the types of high-risk HPV. So there's a reason for almost everybody to get infected with it, or to get the HPV vaccination. What else can we do to prevent second cancers? Well, I mentioned smoking is an important risk factor for HPV-associated cancers. Smoking makes it harder to clear HPV. It's associated with an increased risk of most HPV cancers, and it's particularly associated with throat cancer. We have good smoking medications available, including varenicline and bupropion, that can be used in combination with nicotine replacement. Talk to your doctor if you're interested in quitting smoking, because they can definitely help. So let's talk about cancer screening. Well, what are the recommendations for cervical cancer screening right now? These are for women that have never had a precancer. So if you're less than 21, no screening is currently recommended. If you're 21 to 29, it's recommended that you get a pap smear every 3 years. If you're 30 to 65, you can get a pap smear every 3 years, or you can get HPV testing every 5 years, or you can get both every 5 years, both HPV testing and pap smear. If you're older than 65, screening is not currently advocated, at least by the national guidelines. And there's no cervical screening if you've had your cervix removed. So what about if you've had a high-grade precancer, one of those HSILs? So if you've had an HSIL, the recommendation is that you get HPV testing, high-risk HPV testing, or a high-risk HPV testing plus a pap smear every 3 years after you've had that high-grade lesion treated successfully. So let's talk about, if you've had an HPV-associated tumor in one place, what are the chances you're going to have HPV somewhere else? Or actually, no, this is just HPV. So if you've had HPV in your cervix, what are the chances you have it in your anus or in your throat? Well, if you've had it in your cervix, you've got up to 50% chance of having it in your anus, okay? And if you've had it in your cervix, you have about up to a 7% chance of having it in your throat. These are often spread from one body part to another during sex, but it doesn't have to be from sex. It can be spread through other forms of contact. So that's important to remember. It may be in places that we are not looking for it. So what if you no longer have HPV in your cervix? It's been treated, your doctor has done tests, they say it's not there anymore. Well, it can still be in the other places. This is data from a study from China where they looked in the cervix and in the anus in women every year for several years. And what they found was women were able to get rid of the infection in their cervix, but they still had it in their anus sometimes. And that women had lower clearance of HPV than men did, particularly in their anus. So let's talk a little bit about anal cancer screening. Women with the previous HPV cancer or precancer are at higher risk of anal cancer. Anal cancer is an HPV cancer. We talked about how if you've had an HPV cancer, you're at an increased risk of other HPV cancers. I've mentioned that it's one of the fastest growing cancers in the United States, but we have ways to prevent anal cancer, and they've been proven to work. What we do at Mount Sinai, we started an anal cancer screening program in 2009. Now, this was primarily for people living with HIV because they were at highest risk, and primarily for men, but we've screened lots and lots of women. We do almost the same thing that we do for women with the cervix, except we do it in the anus. We do it in their butt. We do a pap smear and we do high-risk HPV testing. And when we find, cells that look abnormal, we do something like a colposcopy, which we call an anoscopy. We look for the abnormal areas and we can treat them and prevent them from turning into cancer. So if you've had a high-grade cervical lesion or if you've had cervical cancer, I do recommend that you ask your gynecologist about anal cancer screening with either an anal pap smear or anal HPV test. More and more gynecologists are comfortable with this, doing this test, and almost all insurances will cover the anal pap smear test. If you are in the New York City area, you can consider participating in our study. This is an NIH-funded study called the SWAN study, where we offer a free comprehensive screening to women who've had genital HPV-associated precancers. So please feel free to contact me for more information if that's something you'd be interested in. What about vulvar cancer? As I mentioned, the vulva is this area of skin that's outside of the vagina. HPV can also infect the vulva, the outer skin of the genitals. Women who've had HPV-associated precancers or cancers are at increased risk. So any skin abnormalities that you notice in that area should be checked by a gynecologist. I strongly recommend if anything looks abnormal to you there, you should get it checked out. What about throat cancer? These are two famous actors that have had throat cancer. Unfortunately, we don't have the same options for throat cancer that we do for anal cancer and cervical cancer and vulvar cancer. There's no screening test. There is no precancer that we know of that we can identify and treat. But vaccination can still protect against HPV infection in this area. And it's still, and so it's highly recommended, and it's the best tool we have available. And remember, if you've got HPV infection in the cervix, you have a small risk of having it in your throat, but may not have any in your throat. Getting that vaccine is a way to protect yourself from developing infection in the throat. So to summarize what I've talked about today, HPV, human papillomavirus, is a virus that infects nearly everybody at some point in their life. Many people clear the infection, but those that do not can develop precancers and cancers. People with weakened immune system and those that smoke have a harder time clearing HPV. HPV cancers include cervical cancer, vaginal cancer, vulvar cancer, anal cancer, and oropharynx or throat/tonsil cancer. Vaccination is a good idea for anybody and still likely to have value even after being diagnosed with a precancer or cancer. Screening for anal cancer may be appropriate, particularly for women who've had cervix or vulva precancers or cancers, and there's no screening test for throat cancer. If you have questions, here's my email address. If you're in the New York City metro area and want to hear more about our anal cancer screening study, where we do a comprehensive set of HPV testing, we basically test every part where it could be, please email me, or you can go to swan-study.org. And thanks so much to Cher for this opportunity to present.
Thank you so much. That was outstanding.
Thank you.
Now let's start the Q&A. You can still submit questions in the Q&A section at the bottom of your screen. We will try to get through as many questions as we can, but we might not be able to get through everything due to time constraints. Are post-uterine NED patients at risk for HPV-related cancers?
So yes, that's a great question. Uterine cancers are often not HPV-associated cancers, and some hysterectomies will be cervical, will spare the cervix, will leave the cervix in place. So particularly in that situation, screening for HPV-associated cervical precancers should continue. So removal of the uterus often does include removal of the cervix as well. In those situations, you still have several areas where there could be HPV infection. So in the vagina, in the vulva, and then, anus and throat cancers. So, removal of the cervix eliminates cervical cancer from being a possibility, but there's several other areas where HPV infection is still possible. So, I would still highly recommend the HPV vaccination if you're still in the eligible age.
Okay. Are there early warning signs I should look for other HPV-related cancers?
So that's a great question. For early stage throat cancers, many times are visible. Okay. This doesn't necessarily mean you need to go crazy looking in your mouth, but abnormal sensations, swallowing, or new lumps and bumps in your mouth, if you've had an HPV-associated cancer somewhere else, should be checked out by a dentist. And with anal cancer, actually, many early stage anal cancers, you can actually feel them, particularly when you're going to the bathroom. So, and one thing that's very commonly cited with women that have had anal cancer is that they're told that they have hemorrhoids, and it's not actually a hemorrhoid. Doctors actually sometimes have a hard time distinguishing a hemorrhoid from an early stage cancer. So any sort of changes in sensation with having bowel movements, if you've had an HPV associated cancer, is worth getting looked at.
Okay. What are the risk factors for other HPV-related cancers?
Yeah, so the main two risk factors are, probably the most prominent risk factor is, having some kind of, suppression of your immune system. So if you've had a kidney or a liver transplant, some sort of organ transplant, and you're on a strong immunosuppressive medications, or even potentially medications for autoimmune diseases that suppress your immune system, or if you're living with HIV, those are risk factors for other HPV-associated cancers. As I mentioned, smoking is also, it's not a massive risk factor, but does increase the risk of second HPV-associated cancers. So those are the most prominent identifiable risks.
Okay. Are there screening tests in the works for other HPV-related cancers?
Yeah. So, people are, because we have nothing for throat cancer right now, there's a lot of interest in trying to create screening tests for throat cancer. And there are HPV tests that will work for the throat. They're not clinically available yet, but I do think that at some point we will have screening tests for throat cancer. For vulvar cancer precancers and anal precancers, we have screening tests available, and I definitely recommend talking to your gynecologist about those if you've had cervical cancer or high-grade cervical precancers.
Okay. Are HPV cervical vaginal cancers, is it possible to have cervical vaginal cancers after a hysterectomy?
Yeah, so great question. Most times with a hysterectomy, the cervix is removed, so it's not possible to have cervical cancer. But if the reason for the hysterectomy was to remove the cervix because of concern of precancers, then vaginal cancers are a possibility, and patients should talk to their gynecologist about whether they need to be screened for vaginal cancer.
Okay. Is prior endometrial stage 1 related to this talk?
Yeah, so great question. Endometrial cancer is not HPV associated. So endometrial cancer is a different mechanism. And so patients that have had endometrial cancer actually are not at any abnormally increased risk of HPV associated cancers.
Okay. Your charts related to demographics of the cancers focused on white women. Are there any stats on Black women and HPV cancer trends?
Yeah, so that's a great question. In the paper, we included, we looked at Black women and women that identified as Latinx. And so HPV-associated cancers were actually increasing the most in white women. And there was some increase in Black women living in the United States, but it was less actually than white women. And the group with the lowest increase of anal cancers and HPV-associated cancers were women that identified as Latinx.
What type of testing and/or vaccines do you recommend for women over 65?
Yeah, so that's a great question. The vaccine is not supported by guidelines in women over the age of 65 right now, and probably is not going to be paid for by most insurances. I don't think it's controversial for me to say that I would recommend the vaccine at any age, honestly. And it is something that you can talk to your doctor about. We have definitely vaccinated men and women over the age of 45 if we're able to get it for them. But that's not something that would be supported by guidelines. So it's not something that I can make a strong recommendation for. It's just something that I have done. Screening, if you have had completely negative HPV testing or completely negative cervical screening for more than 5 years prior to turning 65, I don't think that there's any reason to continue cervical cancer screening after age 65. But if you've had high-grade precancers, or if you even had cancer, then I definitely would continue to screen over age 65 personally, because the risk does continue to increase as you get older. If there's been no HPV in any of your tests for a long time, I don't think that you need to continue. But again, this is the kind of thing that you're going to want to talk to your gynecologist about. Different gynecologists are going to have different practices.
Got it. And so do you think it's worth it to get the HPV vaccine after you've had cervical cancer?
I do. And that was a lot of the pitch that I was trying to give with this talk is I think that there's multiple reasons to get the HPV vaccination after having had cervical cancer. One of the main reasons is we do see some evidence that there is decreased recurrence of high-grade cervical precancers. And so I think that there is some degree of protection against recurrence, certainly of HPV, but potentially recurrence of other things that we would be concerned about. So I strongly recommend the HPV vaccination if you've had cervical cancer.
Okay. I believe you answered this already, but are you more at risk for having other HPV-related cancers if you've had cervical cancer?
Yes, absolutely. I wish it were not the case, but any HPV-associated cancer, there is an increased risk of other HPV-associated cancers if you've had cervical cancer. So, and the ones that we can monitor for the easiest are vulvar cancer, anal cancer, and vaginal cancer. So those, I would strongly emphasize those screenings.
Got it. What do you think we can do to help end the stigma of HPV and HPV-related cancers?
Yeah, that's a great question and something that we really struggle with. There, I wish we could de-emphasize the idea that this is a sexually transmitted infection, but it's not always spread through sex. And I think that is a really, really important thing for people to realize. You know, women can get HPV in their anus without ever having had anal sex. And I think that is, pretty well proven. And so this is not necessarily a sexually transmitted infection, although it can be spread by sex. So I think if we can emphasize that it's not always spread by sex, it will help to destigmatize it somewhat. But there's always going to be that issue, and it's an infection of sensitive parts of the body, which sometimes people don't love talking about either. So you're right, these are both big challenges, but I think to me that the most useful tool is reminding people that this doesn't have to be from sex, and so that's why it's something that we need to address.
I agree. Do genital warts go away once your body clears HPV?
Yeah, so the wart itself is actually the sign of usually of an active HPV infection. And so the clearance, getting rid of the wart is one way that we help to clear the HPV infection. So, warts can go away on their own. Genital warts or warts in other parts of your body, a lot of times they don't. And treatment of warts can probably, we think that treatment of warts probably does help to clear HPV infection in that area. So that's another reason to consider getting them treated.
Okay. What is the treatment for warts?
I mean, they can be frozen. There is an FDA approved cream that gynecologists can prescribe that you can put on genital warts, that actually what it does is it activates the immune system in that area and it helps to clear the HPV infection and get rid of the wart.
Awesome. I think we have time for maybe one or two more. Are there any downsides to the HPV vaccine?
Yeah, I mean, the HPV vaccine is like any other vaccine. You're activating the immune system, so there can be, rare complications of the vaccine. There can be, allergic reactions. You can, just like getting your flu shot, you can feel lousy for a few days. It can make your arms sore. There are very, very, very rare neurologic reactions that can happen to it. I mean, anytime you're given the HPV vaccine, you should be provided with a sheet that gives the potential complications of the vaccine. But in general, this is an extremely, extremely safe vaccine. I've never, ever seen a complication from the HPV vaccine. But, when doctors, we love to always give the risks, where we try to give the risks we can. And sometimes I think people get a little too focused on the risks because the risks are extremely rare. But yes,
Right.
it's, there's no vaccine that's perfect. And no vaccine that is, completely devoid of potential side effects.
Gotcha. And I'll just do one more. What is being done to educate people on the various HPV-related cancers?
Yeah, well, so cancer.gov is a good website with a lot of, I think, pretty well vetted information about that has a lot of information on different HPV-associated cancers. There are a number of foundations. I'm on the board of the HPV Alliance, which is a foundation that really has a pretty significant anal cancer focus. It was founded by some women that are anal cancer survivors. But there's other HPV foundations that are trying to increase awareness. There's a national HPV day and things like that. So there's a lot of efforts to increase awareness, and this today. So, we are the cancer, to give one more sort of pitch to anal cancer, that cancer, I think, is being underappreciated as a cause of problems, because it is a cancer that we can prevent. It's a cancer that we can screen for. But, when I talk to gynecologists, they're not they're not, you know, a lot of times not telling people about the risk of having HPV in more than one place and things like that. So if there's one thing that I would like to spread, it's that this knowledge that you know, if you've had cervical cancer, or if you've had high-grade cervical precancers, it's really important to ask your doctor about anal cancer screening.
Thank you. Thank you so much for such an informative program. And thanks to all of you for participating and submitting your great questions. Make sure to check out our upcoming educational programs and support groups. Make sure to follow us on social media as well. Please take a moment to fill out the survey at the end of the webinar. The survey will show up in the browser when the webinar ends, and the link will also be in the follow-up email. All surveys are anonymous. This concludes the webinar. Thank you. Bye-bye.
Thanks, everybody.
Thank you.